Hey everyone, it is Dr. Erica Person with Flex Audiology, and I got my girl Stella here. She is relaxing with me today. And this video, we're going to talk about how hearing aids can help with tinnitus. So, do you have hearing loss and tinnitus? If so, there is good news because treating one often helps the other. Now, hearing aids do more than just amplify sound. For many people, they can actually reduce the perception of the tinnitus in their ears. And for a select population of my patients, as soon as they put those hearing aids on, really whether they have hearing loss or not, the tinnitus goes away. Now, I don't want you to get too excited. Once those hearing aids come off, the tinnitus does come back, but at least during that day, they kind of can go about their life. Why does that happen? What is the purpose of that? So for those patients that do have normal hearing and we can put hearing aids on them at a very low level gain, what ends up happening is tinnitus by itself, it's an internal sound that your brain has created on its own. And in the absence of some type of auditory damage, so whether it's showing up on a true audiogram where the professional puts you in the booth and tests your hearing, sometimes the actual damage to the auditory system just is not showing up on that test. That doesn't mean you don't have damage, and that tinnitus is still happening. And your brain, when there's an absence of sound, it will start to search for that sound. It's almost like an amplifier. It's just looking and looking, and it keeps turning it up and turning it up, searching for it. And it can create that missing link that it's not hearing. So when you put a hearing aid on, really what's happening is that hearing aid is giving a low-level stimulation to these external sounds, and it's telling the internal amplifier that it can definitely taper down a little bit, and that takes that tinnitus perception down. So why do they go together then? So like I said, tinnitus cases are linked to hearing loss. That's very, very common, even if you have very mild hearing loss and you can't even, and again, for a lot of my patients, they're not even sure if they have hearing loss. They just know they come in because they've got a humming, a hissing, a buzzing, some type of sound that's starting to impact the quality of their life. And like I said, when your brain's deprived of certain sounds, it starts to generate its own, and that's what we perceive as tinnitus. So the hearing aids, they restore that ambient sound quality. And it just reduces that brain's need to fill in the silence with the tinnitus. It can actually mask it. So some of that internal or the external sound that's coming in, because your brain is focused on that external sound, it actually overdrives the internal sound that it's hearing. And then really, as we're stimulating that auditory nerve and giving back the sounds that it's missing, it's reducing your brain's focus on that tinnitus. So there's just a lot of benefits of treating the hearing loss. So don't be surprised when you go into clinics and that's the very first thing they ask is, do you have hearing loss? Have you treated your hearing loss? Because that really is a critical component. And there is a high percentage of patients that as soon as you put the hearing aids on, the tinnitus is reduced. And maybe even over time, the brain starts to habituate to it and you don't notice the tinnitus as much. I want to be clear, there is not a cure yet for tinnitus, right? There's still hope for that. But the ultimate goal is to habituate it to where there's not any negative emotions associated with the tinnitus. And we do that by redirecting how our brain perceives incoming sound. Now, for a lot of these hearing aids too, they can be used in connection with sound therapy. And I want to be clear that sound therapy is not to be confused with masking the tinnitus. The last thing that you want to do is replace an annoying sound with another annoying sound. That is not the end game. So there is specific tinnitus retraining therapy protocols that people can use. But the key is to find a pleasing sound while not masking the actual tinnitus. And again, retrain your brain to focus on external versus internal. And a lot of times these sound therapy features in the hearing aids, they can be tailored to match your tinnitus. And there's just a few manufacturers out there that maybe have a stronger tinnitus sound therapy programs in them. But it's definitely not a one size fits all. And then hearing aids themselves, if you think about tinnitus creates extra anxiety, it creates extra stress, fatigue, can create depression. And so we know that somebody with hearing loss alone, they have a greater listening effort. So it's more taxing on your body to try to listen all day when you have hearing loss. And so if you're trying to listen really hard, that makes you more tired. It can create extra stress, and that extra stress can lead to making your tinnitus greater. And then having better quality conversations with people, because you can actually hear them, that helps improve your mood, and you're going to be less likely to avoid situations because you are not able to communicate with people around you. So once you're getting out and you're more involved with life, that helps improve your emotional well-being, which alone can help taper down the sound of the tinnitus perception. Now, why should you see a tinnitus trained specialist, specifically an audiologist? Not all hearing aids are suitable for tinnitus relief, and I have had too many patients that have come through the door that their provider, whether it was an audiologist or it was a hearing aid dispenser, they were very, very well intentioned. But unfortunately, what they've done is just simply added a masker. And if you're just simply masking the tinnitus, it can come back 1,000 times worse once you take the hearing aids off. And having to undo and retrain a patient how to not rely on that masker, it's just a lot more difficult to start. So from the get-go, if you have not been to somebody like that, make sure you're finding a best practice tinnitus trained audiologist. So what does that look like? One, they're going to do questionnaires, a lot of questionnaires. They're going to look at your whole body. So we're going to be looking at your sleep hygiene. We're going to be looking at your stress levels, your blood pressure, your oxygen saturation. We want to look at all of that, and we want to rule out medical issues that could be causing the tinnitus. So once we've got all that done and we're tracking that, so it's so important we're tracking that. And that could be, again, not only through the questionnaires, but through technology, the use of technology. We call them biomarkers and biomarker tracking, and you're probably already doing it anyway. So a biomarker tracking, it can already be in your hearing aid. So some of the hearing aids have almost like a Fitbit built in, whether it's your steps and your percentage of exercise. It could be an Apple Watch. It could be the Aura ring or a ring like this. And we want to look at that, and over time, we can start to see a decrease in some of the emotional aspects of your body, and we'll see that that decreases the tinnitus as well. So a tinnitus trained specialist is going to make sure they pick the right hearing aid specifically for you. They're going to know how to appropriately fine tune the sound therapy feature, and they'll be able to provide counseling as well as the biomarker tracking. They'll also follow best practices like speech and noise testing, tinnitus and pitch matching, and just general comprehensive gold standard audiology care. What do my patients commonly tell me? This is the best case scenario. When we talk about that there isn't a cure for tinnitus per se, what we want to look at is on a severity scale. Let's say, and I'm going to really simplify it here, on a scale of 1 to 10, 1 being you don't notice your tinnitus at all, 10 being it's really, really impacting your life greatly. If we can move you, let's say you were an 8, and we can move you down to a 2 or a 3, that would be super successful for us. The ringing or the humming or the buzzing, however you describe it, we want that to feel like it's faded into the background. It's not a sound that's really controlling your life or that it's impacting your life at all. It's something that's manageable and that you can go, oh, yep, my tinnitus is spiking right now. What's going on? Am I stressed? Am I getting road rage? Are my kids acting up? Is my spouse driving me a little crazy? Like, those could be common things that are causing it to spike. And then we want to make sure that you have management strategies in your back pocket to be able to move through that period of time. So super critical you find somebody that is a tinnitus trained specialist, preferably an audiologist, and then really just ask them about their education and kind of what got them into this. And that'll really kind of help you weed out some of the places that are online. So if you have tinnitus and you have hearing loss, please don't discount the power of getting hearing aids, and then definitely work with somebody that knows what they're doing. And if they have biomarker tracking, even better. If you have any questions, drop me a line, but I would love if you could subscribe, hit the like button. Anything we can do to get more information out to the masses is much appreciated. And until our next video, hope you guys are doing well. Thank you.